Good afternoon. Welcome to the In Results podcast. Good afternoon, Alistair. How are we?
Oh, hi, Ben. Good afternoon. Yes, very well, thanks.
Baking in the sun. And today we're going to tackle a subject which is in the news at the moment, quite rightly and about time, regarding menopause at work, Alistair. And you've been an employment lawyer, you can see it coming into your line of work very quickly.
Yes, I think it's been on the radar for a couple of years or so. Recent media coverage has been, obviously, it's been on television. We've had documentaries with Davina McCall recently, and it certainly helped raise attention on something which, of course, is as long as time. It's as old as time. And finally, we're seeing some recognition, and that's been filtering through into the workplace in recent times, in recent years. Thanks, really, to our guest today, Lauren, who I met a little while ago now, who's been promoting menopause in the workplace and helping employers, first of all, understand and then address it in a constructive and supportive environment. And Hannah's with us today because Hannah's actually able to address the symptoms and help treat perhaps a more holistic fashion than traditional medicine alone.
That saved me introducing the guest, which I normally do, Alistair, but that's a perfect gateway.
Thank you. We haven't much time today, Ben.
Anybody think we practiced the openings. So, Lauren, we'll come to you first. Tell us about you and what you do, and more importantly, tell us about the vital work you do in raising awareness. And when we were talking prior to the show, you said menopause savvy. And I think that's a perfect way of saying how the employment world needs to approach this. Over to you, good self.
Yeah, I think it's a really fascinating topic and something I would never have dreamt of talking about publicly or standing on stage and talking about or teaching people about or supporting people through. But I left my job in my early 40s thinking I had early onset dementia. I was a senior leader in financial services and loved the job that I did. So when I found out 3 months after leaving work that I had just been through an early menopause, I was absolutely flabbergasted. So that put me in a bit of a mission to discover what menopause was and find out why I had completely misunderstood my symptoms, why I hadn't been aware of what menopause was. And I discovered that over 86% of people that go through menopause don't know what it is and don't know how it might impact them. So from that place, it's not surprising that so many people are leaving the workplace now, not joining the dots, not knowing how to ask for help and support because they don't know what they're going through. So that led me to working with a number of individuals to support them going through their journey. I'd retrained, my backgrounds in personal training, nutrition, sports therapy, neuroscience, mental health, and a whole load of other related subjects. So I've worked in the wellbeing space for over 30 years. And as I was working and supporting people going through and helping them find solutions that worked for them, a lot of common themes were coming up: nutrition, self-care, lack of sleep, just basically people not looking after themselves at all, which means as they're going through the hormonal disruptions that occur during menopause, they're not in their optimal well-being, which means they're not performing particularly well at work. And all of that is manageable with the right help and support. And I know Hannah's got some phenomenal opportunities, for people to look at and how they can and manage their way through menopause. So after doing that, those individuals said, come and talk to us at work. So I started talking to employers and we started looking at, actually, we need to get people moving their bodies. They can't be sat in front of a desk all day. Or if they're looking, if they're frontline workers, they need a break. They need to be able to go to the bathroom. It's not normal to be on your feet or to be sat down all day long without going to the loo. It's not healthy. We need to make sure people are well hydrated, give them access to natural light. There's lots of very simple things that we can do in the workplace to improve the experience of going through menopause. Over the last 8 years, we've developed policies and guidance. We've looked at uniforms. We've looked at different adjustments that organizations can make. We provide specialist coaching services so that we aren't just executive coaches, but we're health coaches specializing with special menopause training to help people in the right space. And that's beginning to pay dividends now because organizations can say that they are menopause savvy. They can show and demonstrate they've got in-house talent because we've trained menopause champions and menopause coaches, and they can put their money where their mouth is and increase their retention rate, increase their productivity and their performance rate. Too many people just don't know what menopause is and don't recognize that it's a time when you need to really rethink your lifestyle choices.
And I might just bring you back to a stat you said, 86% of women don't know when they're going through the menopause themselves. If 86% of women don't understand the start of menopause, then they're not going to relay that to their employer, are they?
Yeah, I think, that's such a powerful statistic. There's so many stats in this space, but, over 86% of people don't know what menopause is or how it's going to impact them. So if they don't know what they're going through, they don't know to ask for help and support. But also, I thought menopause was this thing where your period stopped, you might have a hot flush, and it was for older women. I had no clue that this phase called perimenopause existed for a few years leading up to menopause. Menopause in the West still happened between 45 and 55 for the majority of people. But there are a number of us like myself who will go through menopause under the age of 45 or under the age of 40, which would be an early or a premature menopause. And in that case, your perimenopausal years are even earlier. So your whole experience could be, 2, 3, 5, 10, 12 years long. And, from one start of the experience at perimenopause all the way through to postmenopause. And we need to be educating our people as they're coming into their 30s, at the latest. We need to be educating people so they're ready for this transition, because other people will also become menopausal because they have a surgical menopause or a medical menopause. And we have to have our employers ready to support people in back to work programs, from oophorectomies, hysterectomies, cancer treatments, looking at menopause as well as the back to work from whatever they've been off to be supported with.
Would it not even be educated in the education system itself? At young, obviously, the age-wise, you'd have to think about that, but certainly later on at school age, because obviously, even if the male population are learning about it, if they become entrepreneurs, they'll understand it a bit more. Well,
it's on the secondary education curriculum now. It became part of PSHE back in 2019. Pandemic got slightly in the way, so not all schools had picked it up. But, I'm pleased to say that there's a number of schools now looking at how they can provide age-appropriate conversation and education around menopause at school.
Yes, hearing you, Lauren, rattling off some of the things that employers should consider, it just highlights actually how inconsistent things still are across employment and across companies of all sizes. The Employment Appeals Tribunal is quite happy to listen to arguments on both terms of disability and direct and indirect sex discrimination. So, and actually, as a lawyer, I don't see why not. I think the law as it stands can cover it, but if there needs to be law change as well, so be it. But case law itself helps, but again, it takes a few years to work that out. You don't get consistency from case law all the time either.
Yeah, the tribunals citing menopause are still, the numbers are quite small, but there were twice as many in the first half of 2021 than the whole of 2020. Having worked with so many employment lawyers up and down the UK, there's an epidemic of women being managed out on non-disclosure agreements and settlement agreements. And those numbers are far higher than those that are going to tribunal.
I don't doubt it, yes, because the employer will approach the situation from a unsympathetic performance issue. Once you start having those conversations, you have to be extraordinarily resilient to want to basically fight on and also have the resources. The likelihood will be that for every small handful of tribunal claims, there'll be hundreds and hundreds, thousands of settlement agreements. I'm sure of it.
If I can bring Hannah at this stage, I think Hannah, obviously you're the educational side of things, and I think if you can work with companies rather than individuals, it would make a massive difference.
Yeah, I mean, I work with a lot of self-employed women as well, and obviously they haven't got that framework in place. I've lost count of the number of ladies that I've worked with who've been that close to closing their business, and it might have taken them 20 or 30 years to build the business, and they just can't do it anymore. Yesterday I was talking to a nurse she'd been a nurse for 35 years, and at Christmas her menopause symptoms just got so bad she had to quit. So her salary has dropped by 80%. She's got a little shop job, and she's really upset because she loved nursing. She wanted to continue nursing for a while longer. Let's face it, we have a shortage of nurses. We could do with her coming back into work. But her employer was not at all supportive, not at all helpful. And the same went for her GP. The GP offered her antidepressants, even though she met the criteria for HRT. All she was offered was antidepressants, and she just kept saying, I'm not depressed. This is not depression. I know, I know myself. I work in healthcare. I know my own body. This is not depression. This is menopause. And the GP would not listen, wouldn't refer her, wouldn't give her HRT.
The disappointment that an employer, the health service,
Mhm.
at NHS Trust could be so unsympathetic. And
Hannah, I'm guessing that obviously the preferable situation, not just for you, but for many people, is prevention rather than cure. To get to that stage, obviously we can't prevent menopause happening. We've certainly prevented a lot of the build up, and then it hitting people without awareness. The mental health side of things would be a massive advantage, wouldn't it?
Yeah, I mean, I think if we dive really deep into it, our menopausal problems start actually decades before perimenopause starts. And it's like Lauren said, there's often been years of not taking proper care of yourself, not getting enough sleep, not eating properly. And as women, you know, many of us are parents, or we're caring for elderly parents, or we put our career first, and that we put ourselves last for 30 odd years. So by the time perimenopause comes along, we're already on a back foot. We're already chronically undernourished, chronically overtired, overstressed. And, you know, you're expecting a lot of your body at the best of times. It's quite a big transition to make. And if you haven't got the resources there, it's no wonder that you run into trouble, is it? Things are starting to improve a little bit. Self-care is more of a thing. Workplaces are getting a little bit more on board with workplace well-being. It's not so cool to work an 80-hour week, is it? It's more cool to work a 4-day week and get a bit more balance back. So we're slowly edging in the right direction, but there's ever such a lot of work left to do. And also I find with my patients in particular that if they've got a history of gynae problems that might go back their whole adult life, their hormones were never in balance in the first place, and then they hit perimenopause and it just makes matters so much worse. So, you know, we shouldn't be talking just to perimenopausal and menopausal women. We should be speaking to all women of all ages and saying, you know, just get your health in order as best you can. And I know it's complicated because, you know, compared to what we can do in alternative medicine, if alternative medicine toolkit is like this, the mainstream medicine toolkit is about that big. So there's only very few routes you can go down with mainstream medicine where there's really no limit to what you can achieve with alternative medicine. The problem is that you have to self-fund it because we're not available on health insurance or on the NHS at the moment. So, and obviously that's a barrier for a lot of women. So it's a kind of a complex situation.
Is it a Western world problem, or are we leading the way, of course, in trying to educate the world?
It's interesting. So there's massive cultural variations in how people experience menopause across the world. And we actually go through a later menopause in the Western world than we do in the Eastern countries. In some countries in the East, we don't even have a word for menopause. And in others, we have special words, you know, like second spring, and we celebrate our women as they become older because they become our matriarchs and the people that are looked up to. And in societies where there's much more of a culture of family and community, it's seen as a stepping stone, a badge of honor. And where you've got the grandparents looking after their grandchildren, supporting, you know, having that support mechanism in place, we don't have that very much in the West anymore. No. In America, they've got less than one person in their life. People have got less than one person in their life that they could phone at 3 o'clock in the morning that they knew would be there. In the UK, we're not much better than that. We just don't have the community. So our stress levels are higher. Our insulin levels are much higher, and all our happy hormone levels are a lot lower. So we're starting from a very poor base. This is a chronic long-term problem that is exacerbated by the declining hormone levels during perimenopause and menopause. You know, different cultures experience different symptoms. In the East, some parts of Asia, you'll find that it's headaches, chronic shoulder problems, different types of joint problems that are more prevalent, whereas we're having the hot flushes, the lack of sleep, the night sweats, the anxiety, the low moods, all of these things. And that's why so often when you go to a doctor on the National Health Service, that you'll be prescribed antidepressants, because you walk in, they've got 10 minutes, if they're lucky, they've got 10 minutes to talk to you. You walk in stressed and depressed, and the obvious thing they're going to do in their quick critical assessment of how you are is put you on antidepressants. They're treating the wrong body system because they haven't been educated in menopause. And I always say to people, if you're going to your doctor, you've got to ask for a double appointment, regardless of what is going on in your surgery right now, ask for a double appointment, ask for the person who may have some menopause training or is interested in women's health. If you can't get hard in your surgery, try and change surgery, but go in with a symptoms list. Go in with the NICE, the NICE guidelines on menopause, which are currently being updated, and sit down with your questions written out to ask your doctor. Make sure that you let them know that you are thinking that you're in perimenopause or you're menopausal, and have that conversation, because it may not be what's coming to the front of mind for them, especially if you're in your late 30s, early 40s. Often doctors would just say you're not old enough, or it's just a women's issue, and they'll brush people off. But I think, again, you know, with the coaching and the lifestyle work that we do, and the medical herbalist work that Hannah does, all of these things are not available for everybody because of that price point differential. So we do need to start finding ways to have holistic approaches to menopause, and just get the awareness out there that stay away from the alcohol, the caffeinated foods, stay away from processed foods and refined sugars. All of these things will typically, not for everybody, but for typically, they'll play havoc with somebody who's going through menopause. So even if you've gotten away with it for years, this is the time in your life when these things are probably going to come back and bite you in the bum.
Lauren, a lot of things you said there are just general good, healthy life advice, aren't they, anyway? Never mind just this subject. Hannah, how can people help themselves?
If the funding is there, if you are able to do it, it's always better to work with a practitioner, get yourself properly assessed, and actually allow someone to look after you for a change, because that's a big thing as well. We're not used to it. We're kind of used to being the carers, not the cared for. So if you can let someone else take care of you, it's a good thing to do. But otherwise, it's like Lauren says, you know, learn about nutrition, learn about what your body needs, and maybe some fasting. Weight-bearing exercise is really important as well for bone strength, as well as for mental health and weight management and all of those things. It's the stuff that we kind of already know we should be doing, but we don't prioritize until things start to go wrong. And even then, sometimes the motivation isn't there in the amounts that you need, which is why it's good to work with someone like me. I've sort of learned by my mistakes over the years. I used to run health coaching programs where I would do an appointment with someone, write them a beautiful book, hand them the book and say, here you go, here's your set of instructions, crack on. And I'll call you in a few weeks and see how you went. And surprise, surprise, nothing changed. Yeah. And it wasn't until I started saying, right, we're going to meet once a week for 15 minutes and you're going to tell me how you went and we'll set the goal for the following week. It made a massive, massive difference because they're accountable to me. And we typically get about an 80% improvement in 8 to 12 weeks in all symptoms. However desperately bad things are at the start, we generally get an 80% improvement.
Alistair, just to bring your good self back in here just before we wrap up, I think the thing is do something now before it's too late, isn't it? It's a bit like everything in life, really. We always attack health problems and say cure rather than prevent, where it should be prevent rather than cure. And I think that just runs through the whole healthy life system, doesn't it?
From my perspective, I've learned so much already in 20 minutes or so. It's really education, not to suffer in silence. Seek help professionally. People like Lauren and Hannah can help just raise that awareness and also come up with practical solutions. I think fundamentally employers still need to get a job done. But you know what? With flexibility, I think the pandemic has shown so many employers have found that hybrid working can work. You just find other ways of doing it, other ways of making sure you've got KPIs, etc. So work with staff. It's always difficult to decide how much support and patience you can apply to a particular case on the facts presented with, and that's really where we will continue to get disputes.
Lauren, Hannah, it's been an absolute, I don't want to call it a pleasure because it's not a subject that we would like to talk about and raise awareness. We would hope it was already there. But your education, the way you've spoken, it has been absolutely phenomenal. And if we've improved one life, we've done a job, and that's like we've improved a lot more. Thank you very much for joining us today. From my side of things, that's it. Alistair, I'm sure you'd like to thank your guests today.
Yes, thanks, Lauren and Hannah. It's been really interesting, thank you, and it's certainly helped with my understanding. It's nice to hear people talk about it rather than just read dry legal text.